you starve the baby? Always a great question to ask a worrying pregnant lady. The answer I gave people was, no, the baby is fine. When you're pregnant, the growing baby is your body's first priority, so any nutrients you put into your body go straight to your baby. However, with a restricted intake, you need to make sure to maximize the nutrients you're getting. All of my doctors were aware that I'd had the procedure, so they paid extra attention to the baby's measurements. I also went and saw my dietitian in the first trimester to find out what I would need to do to ensure I was getting enough food for the two of us. She gave me a great eating plan and went through everything with me. She recommended that I take a multivitamin to ensure that if I didn't follow the plan, that I'd be at least assured I was getting the nutrients. My IVF clinic recommended the same thing, so that was easy enough to do. Were your doctors concerned? Yes, and then no. Initially they said that my pregnancy would be considered a high-risk pregnancy because they would need to ensure the baby wasn't being affected by it. Basically it just boiled down to a couple more ultrasounds than the normal patient, but it turned out to be all for naught. Except it meant we got to see the little man a lot more, which was lovely. Ironically, they actually thought I was going to have gestational diabetes given the size of the baby on the scans. I didn't have it, I just had a big baby. Was your reading impacted? Yes. But again, I suspect it was just one of the things about being pregnant and had nothing to do with the gastric sleeve. I had morning sickness, which in some ways was better because of the sleeve, less to throw up, and I had indigestion. Tums is the best invention in the world. I thought that towards the end of my pregnancy I would be spared the complaint of the baby pushing up on my stomach that I had heard other expectant mothers state. But alas, no, the little tacker still managed to get his head/butt/feet into that space enough to cause me discomfort. I did find I was hungry for the first time really since having the procedure. I found after having the procedure that I just wasn't hungry anymore. I couldn't tell you what I wanted to eat, my body just didn't care for food in the same way. However, with the pregnancy I had my first ever cravings again. I could tell you exactly what I wanted to eat and when. It was brilliant. After the procedure I developed an aversion to milk, which sucked because I adore milk, but while pregnant I would chug that stuff like it was water. Once the baby was born, back to not being able to handle large amounts of milk. When you were pregnant, could you see your stomach, gastric sleeve in your ultrasounds? Nope, the only thing I saw in those ultrasounds was the baby. Well, sometimes I suspected they were just showing me random screen snow. I mean, seriously, how could they tell that was a kidney when the kid's no bigger than a plum? How much weight did you gain? Have you lost it? I gained 12 kilograms in total for the pregnancy. I have to admit it really hurt watching those scales go up instead of the down that I had become used to. I just had to remind myself that it was for the best. I'd love to say I didn't gain too much because I ate so well and exercised regularly. Far from it, I ate like a horse and I didn't move my ass off the couch the entire time. I just got lucky. The dietitian told me to expect to put on between 10 and 12 kilograms and that would be a healthy gain for my height, etc. On the day of delivery I lost 7 kilograms, I had a 3.5 kilograms baby, and by the time the little man was 3 weeks old I had lost 17 kilograms in total. I was under my pre-pregnancy weight. Again, love to say it was all diet and exercise, but it was sleepless nights, anxiety, lack of hunger and illness that did it. I'm such a great role model for healthy living. My lack of hunger was so bad that it was an issue with the midwives while I was in hospital. They kept telling me to eat more and I kept having to tell them that I had a gastric sleeve and that was as much as I was going to get in. It was annoying, but they meant well and they were worried about me, so you can't be annoyed with that for too long. Did it affect your ability to breastfeed? Nope. Ultimately my milk never came in, but that's just the luck of the draw. We did everything we could to try and make it happen, but it didn't. The doctors and nurses said it could be down to a number of factors, PCOS, C-section delivery, IVF, but no one really knows why, and no one ever mentioned the gastric sleeve as a possibility. Personally, I don't think it played a part in my inability to breastfeed at all. So, that in a nutshell is my pregnancy experience as it relates to being a gastric sleeve recipient. It is by far still the best decision I have ever made. I look at the little man every day and thank the Lord for him, and know that having this procedure played a crucial part in the dream coming true. If you'd like to know anything more or want me to expand on something above, just leave me a comment. I might not answer it straight away. Running around after the baby and packing to move is currently cramping my style, but I will get to it. When will my baby bump start to show? There isn't a set time when moms-to-be start sporting an obviously pregnant belly. Every woman is different. Some women keep their pre-pregnancy belly far into the second trimester, while others start showing in the first trimester. Some women notice bloating, not the same as showing, but a swelling that can make their pants fit tighter, shortly after they get a positive pregnancy test. First-time moms usually begin developing a baby bump between 12 and 16 weeks. Moms who've already been pregnant start showing sooner, since their uterine and abdominal muscles have already been stretched from an earlier pregnancy. See the results of our poll on belly bump timing in first and later pregnancies. By about 12 weeks, the uterus expands above the pubic bone, says Catherine Hansen, assistant professor of obstetrics and gynecology at the University of Texas Medical Branch Galveston. Before that point, the uterus remains within the pelvis and isn't usually visible. If your belly is expanding sooner than expected, it could be due to these conditions: bloating, gas, constipation. Less often, twins or multiples are responsible for an early bulge. Should I be worried if I'm not showing yet? If you're showing later than expected, don't fret. The uterus can rest in the body in a variety of positions, says Hansen. Sometimes a woman's uterus is tilted toward the back, retroverted, which can cause her to show later. Conversely, women whose uterus is tilted forward, anteverted, may show earlier. Showing late doesn't automatically mean that your baby is too small. We only start to assess whether the baby is measuring too small when we get to the second and third trimester, says Hansen. If there's any reason for concern, your healthcare provider will do an ultrasound to make sure you've been given the right due date. Babies who are smaller than expected for their gestational age will get frequent monitoring to make sure they're doing well. What pregnancy symptoms will I have at 3 weeks? It is possible to get the feeling that you're pregnant soon after you've conceived. So you may experience very early pregnancy symptoms at 3 weeks. One of the earliest symptoms you may feel is a prickling, tingling sensation in your nipples, which can sometimes feel very sore. This happens as pregnancy hormones increase the blood supply to your breasts. You may develop cravings for some foods, and not be able to bear the taste of things that you used to enjoy. Common culprits are coffee, tea, alcohol, fried foods and eggs. You may get a metallic taste in your mouth and be extra sensitive to the smells of food or cooking. Some women also notice that they have an increased amount of vaginal discharge at this stage. Morning sickness usually starts at about 6 weeks, but it can start as early as 4 weeks, or around the time that your period is due. A few moms-to-be experience nausea even earlier than this. Pregnancy hormones may have already started to make you feel tired and weepy. You may feel exhausted, and struggle to stay awake during the day, as your body cranks up to support your baby. Bear in mind that at 3 weeks, you won't yet know if you're pregnant or not, as you probably only conceived a week or so ago. It's not possible to tell on which day you ovulated and conceived, which is why pregnancy is usually counted from the first day of your last period. If you think you might be pregnant, but your next period is still a week or so away, you may wonder when you can take a pregnancy test. The more sensitive home pregnancy tests can detect low levels of pregnancy hormones as early as 4 days before your period is due, or 7 days after you've conceived. The most reliable sign of pregnancy is a missed period. So generally speaking, home pregnancy tests will give you an accurate result if you test no earlier than the time when your period would normally be due. So try to wait, as hard as it may be.